This segment of Delmarva Life is brought to you by Peninsula Home Care.
Okay, so stop just for a second and think about everything that you've already done today. The small things that seem so minute. Answering the phone, reaching for that cup of coffee, making yourself a sandwich.
Yeah, you probably don't think twice about these things, you just do them. But for the more than 700,000 stroke patients in the U.S. each year, they know just how much of a challenge these daily tasks can pose.
It is comforting to know, though, that support is available. Devices designed to help reprogram the brain following a stroke or an injury. So joining us today to tell us more about these devices are Peninsula Home Care Community Liaison Therese Ganster and physical therapist Catherine Sinowitz. Thank you so much for coming in today. Therese, tell me about these things. What's the deal here?
Well, think about a person who you may have known who had a stroke. Oftentimes they are impaired and their hands are kind of fisted. They can't open it to extend it. So if we're having it closed in this vein and you're trying to pick up a ball, it's not going to work because your hand is closed. So what these devices do is help open it for you so you get that grasp reflex back. And while it's doing that, it's retraining your brain. It's beginning to tell your brain, okay, I can grasp, I can flex.
And your therapists have always worked with stroke patients.
Absolutely.
So to get over these things, what is the biggest challenge that they find when working with the patients?
I think that it's the patient lacks hope and they also lack control. This gives them immediate control. It immediately gives them the opportunity to grasp where they hadn't been able to grasp before.
It doesn't replace the therapist.
No, the therapist is key. As we'll be seeing, they have to be able to fit the device, and then they have to be able to work with you with your program to make sure that the device is working, and then they have to begin to tweak it as you begin to regain some of that.
All right, Catherine, you had to go through some training to work with these devices, which you're going to show us what I have on my arm in just a few moments. What was it that you had to learn?
We took a comprehensive online course designed for therapists in conjunction with a lab where we learned how to measure and fit the devices. And then, of course, we had to take an exam on the material we learned.
Okay, so you've got different devices for different parts of the body, and you're going to tell us more about that. Tell us about this that you've got on Lisa's hand.
So this is the Sabo Flex. This is designed to have the hand in a stretched position because, like Therese was saying, for someone that has a stroke with increased tone, they're more like this. So, and research shows that when you stretch out that muscle for a prolonged period of time, it gives them the most benefit of getting the function back in the hand. So the Sabo Flex will, when it's fitted appropriately, the fingers will be extended and keep them in the right position to be able to grasp an object and release it.
So I'm going to...
So she can actually use this
to grab a ball. You could put it in the bowl, and of course, you know, we're going to be doing repetitive tasks like this to get the person used to it, reform those neural connections, and then we could translate that into activities of daily living, like reaching for your cup of coffee.
Right. That's incredible. Okay, now you've got a couple more things here. What are these? What is this?
So this is the Sabo Stretch.
Okay.
Like I was just saying, prolonged stretch really helps to get those muscles and joints in proper alignment for function. So this is really comfortable.
Yeah, show me on Therese's hand how that would go on.
You're going to place this here like that, and
It
this
looks
would
like it's
mold to the
flexible.
forearm. It's very flexible. In fact, that's the benefit of the Sabo Stretch as opposed to other devices. The other ones are really rigid and plastic, and the fingers can come out of it, which, if that happens, that could lead to joint damage and pain and discomfort. But with the Sabo Stretch, the device is supportive, but it's flexible. So if the patient, and as I get this on you, you'll see what I mean. Oh, you know what, Therese, let's get your pinky out.
That first.
So as they develop flexibility, can you adjust this?
This is really just to keep their hand in one position. So that they stretch out. So you remember, they're like this. So that's really uncomfortable for the patient. We're going to get them stretched out, their wrist and their fingers stretched out like this, so that eventually they're going to be in a normal position to be able to grasp and hold things. And research shows that needs to be on for about 6 to 12 hours to benefit them. Now, this, if you go ahead and flex your fingers, Therese, so the brace is flexible enough to allow for movement without the fingers being displaced.
Okay.
But it's supportive enough to bring her right back into a neutral position when she relaxes.
And when we talk about stroke patients, we're not just talking about people who just had a stroke. Someone could have had a stroke years ago and they can still benefit from this therapy?
Absolutely.
That's amazing.
Incredible.
Up to 20 years.
Up to 20 years.
Up to 20 years.
Wow. Okay, so this was, you were saying this was for an elbow?
Yes.
Yeah.
The Sabo Flex is obviously for the wrist and the hand and the fingers. If we add the Sabo Reach, that will bring in the component of the elbow.
Right.
So for patients that have more in-depth dysfunction of the whole limb, we would incorporate that.
Okay.
Right. So if we know somebody, a stroke patient, what do we tell them? I mean, how do they qualify to get these?
Just call us. Call Peninsula Home Care at any of our offices, and we are more than happy. It is Medicare certified. Most insurances will also cover it, and we would be able to work with the physician, explain to them what we're trying to work with through that process, and be able to get them hooked up and
ready to go.
Retrain that brain.
That is great, and giving them hope.
And giving them hope.
Therese, Kat, thank you so much.
You're welcome.
Technology. To read more from Peninsula Home Care about this treatment, go to WBOC.com and click on our picture at the top of the page. Some real breakthroughs there, and Jimmy, even more advancements. More and more women are starting their own businesses every single day. We'll hear their secrets to success.
And right here on Delmarva, one group rewards strong, independent entrepreneurs. You're going to find out how you can turn your idea into great success. Delmarva Live will be right back.